two vaccines, one made by Moderna and the other by Pfizer and BioNTech, are safe. They're well tolerated. People have had side effects, but they tend to be mild and self-limited, generally lasting a day, not serious, and no long-term sequelae have been seen so far. It's important to have as many people on the staff who are culturally competent in working with diverse communities. So we were very fortunate to have head of our community education process who is part of the African American community, who is well networked and knew who were some of the key opinion leaders. We met with all these key opinion leaders and were very available. We wanted to be extremely transparent, share all the information that we had about the vaccines in real time, and make it clear that we're a community-based organization. We're not going anywhere, and we, like they, want to have the best solution to this horrible pandemic as quickly as possible. And to get to that place, we're going to need to get people vaccinated. And we made it clear that we had a shared common goal and wanted to be available to answer all the questions that people might have. It's not as if the barriers to COVID-19 vaccine distribution have evaporated overnight. There's a long legacy of medical mistrust, particularly in the African American community, but in other communities of color. This legacy comes from experiments like Tuskegee, Henrietta Lacks, as well as the kind of racism that people are perceiving in the current environment. We're living in an era where people have access to instant information, but doesn't necessarily mean it's the right information. So we have to spend a lot of time trying to share the facts, the information with people and help them make informed decisions about their participation in vaccination programs. Community health centers are extremely well placed to be the front lines to get people access to vaccines. Community health centers very often have credibility. So the first place to start is with the staff of the community health centers to make sure that everybody on the staff has all the information available, has all their questions answered, so they can be good ambassadors about the vaccine. Nothing will help ensure trust in the community than having as many people in the health center vaccinated as possible, so they can tell people their firsthand experience of what it was like to get the vaccine and why they trust the vaccine process.